Exercise is essential. Hi, my name is Luke Vu, PhD, clinical psychologist, mental health expert, helping young men overcome digital addiction, depression, and anxiety. In this video, we're talking about exercise and why it's so important. Simple as that. Quick disclaimer, I'm not your psych, this isn't treatment, and if you need a psych, you should find a registered, qualified psych in your area. Let's go over the basics. Exercise is really good for you. If you want to improve your mental and physical health, you should start with exercise first. There are many benefits to exercise. It improves your cardiovascular health, reduces risk of a range of metabolic and cardiovascular diseases. It improves your cognitive functioning, and it's also known to increase BDNF, a protein related to neurogenesis, that is the creation of new brain cells. Now, exercise is shown to be as effective as an antidepressant for the treatment of depression and anxiety disorders. It is also effective for the reduction of PTSD symptoms as well. However, there are some unique psychological benefits of deliberate exercise as opposed to incidental physical activity like walking to your fridge, such as focus. Exercise is a form of mindfulness, meaning that it's a deliberate control of your attention and focus. You are training your brain to switch off and focus on something that you choose, an essential life skill. In fact, the more you engage in exercise and increase your level of exertion, the easier it is to focus on the activity itself. It's hard to worry about what your neighbor thinks of you when you're going for an ocean swim. Mastery and competency. You'll notice yourself becoming stronger, looking better, feeling fitter, faster, and sharper. You physically see the positive effects of driving yourself independently of anyone else's influence. You can observe yourself changing physically and mentally as you get better at your activity. And these changes tend to be long-lasting. You're getting better at jiu-jitsu or you're serving faster in tennis. Healthy stress relief. Exercise helps you disengage from mental and physical stressors, and it's largely independent and in your control. For example, if you have a tense conflict at work, your work satisfaction might decrease, but that doesn't diminish your opportunity to exercise and blow off some steam. Social. Depending on the activities you choose, exercise can help meet your social and belonging needs. Being part of a sport, having regular catch-up with friends with similar goals and interests is a massive part of managing mood. This is really helpful if you find yourself prone to withdrawing from life or isolating yourself when you're experiencing anxiety or depressive symptoms. Consistent engagement with a supportive social circle will help prevent symptoms or accelerate your recovery. How much exercise should you have in a week? Well, this depends on your goal. If you're completely sedentary and have a history of mental health symptoms, sometimes the barrier is lethargy or inertia, and it's hard to want to do anything when our symptoms are quite severe. To manage and improve your mental health, at least one dedicated time slot per week is close to the minimum effective dose, and probably the most you can motivationally handle at that point. It means there is at least one predictable time where you can look forward to and feel relief and positive reward. This might be weight training or dance class, rock climbing, swim classes. Remember, that's the minimum. You can start to build a higher volume and intensity of exercise as your mood and symptoms improve. To help manage weight, reduce risk of sarcopenia if you're elderly, or reduce risk of metabolic disease such as diabetes, resistance training 2 to 3 times a week will work, and aiming for a cumulative effect of 2.5 to 5 hours per week. Personally, I think we should look at it the other way. What is the most exercise we would like to engage with that is sustainable, fun, and improves relationships or other areas of your life? For mental health maintenance or even optimization, I tend to encourage a higher range, up to 5 days per week. This could include home workouts, going for walks, bike rides, and etc. If you have more physically oriented goals, adjust accordingly. What if you have no time? You have to make time. However, you don't need much. There's always 15 minutes in a day that you can reallocate. If you think about the time that you spend on your phone, gaming, or binging on Netflix, you would only need to reallocate a fraction of that time. Remember, you can still purposely enjoy this time by listening to music or a great podcast. You can even watch a movie off your phone on the treadmill if you like. A 1-hour block of time or 3 intervals of 20 minutes per week can help you sleep better, live longer, be stronger, and have a better mood. That's a pretty good deal for 20 minutes every few days. I appreciate that there will be times in your life where you can't allocate the time. You can still plan your day to capitalize on incidental physical activity. activity. This might mean walking an extra distance to work, grabbing lunch from that spot a few more blocks down, or taking the stairs instead of the lift. These are great little adjustments that shouldn't pose a serious burden to help you become more physically active. Why is it so hard to start exercising regularly? How do I get over this? Whenever we want to do something for ourselves that's good for us, we should expect some form of difficulty. We call this resistance. Let's go over some of these different factors. Anxious thoughts. Sometimes we think about what others might think of us. For example, we might think we look clumsy or lost or inadequate. If we attend that first gym session, we might feel some discomfort in feeling that we're inadequate or judged in some way, and that's only natural. We discourage ourselves from trying and initiating when we believe in anxious thoughts. This process where we are consistently dissuaded by anxious thoughts is referred to as avoidance. And it's important to recognize that those are the thoughts that are holding you back, and you don't have to believe them. And even if anyone notices or even cares about your inadequacy, and that's a big if, you can still push through and be okay. Depressed thoughts. Sometimes we underestimate how exercise can help anything in the grand scheme of things. Again, we have to call them out and challenge these thoughts. First, it's unlikely to be true. Your mood is very likely to improve, at least momentarily, and consequently, your ability to solve problems will improve. Don't rule yourself out before even trying. Wait until after the workout to decide if it's worthwhile. Better yet, wait until after 10 workouts before evaluating if exercising is helping rather than hindering you. We call this the behavioral experiment. Sometimes you just have to try for a little bit before you can get started. Inertia. Sometimes the size of the change is discouraging, and it's easier to stay the same because change is never comfortable. The trick here is to slowly build the habit of exercise. Start really small. This could even be just checking out the gym, or only try one machine until a habit forms, then level up just a little bit. Sometimes we have this assumption that we need immediate fast change. Take the time limit off. You're meant to enjoy the process eventually. You just have to slowly start at the smallest step that you can handle today. Rinse, then repeat. Can exercise improve the effectiveness of therapy? 100%. If you aren't exercising and you're able to, starting and maintaining an exercise routine will help therapy. This is because exercise alone will make it easier for you to manage symptoms, which means that you'll have more mental resources to apply a more specific skill to address your mental health symptoms. In addition, consistent regular exercise improves sleep and helps regulate your eating patterns. It's cost-effective and efficient compared to other intervention tools. For example, writing techniques are a common intervention used in CBT, but the effort of writing in your journal about your feelings and thoughts can be quite difficult when compared to the fun of going rock climbing or rolling on the mat with some friends. The more stable your lifestyle factors are, the more likely you can engage and benefit from higher effort interventions. So for example, if you're experiencing anxiety symptoms, it's likely you have to engage in some sort of exposure task. That is learning to confront the thing that you fear in a gradual way, be it dogs, flying, crowded places. Exposure interventions are exhausting and you'll come home needing to recover. If you have a firm routine of working out, eating, and sleeping well, then you'll maximize your recovery and feel ready to make more progress and be willing to confront more stressful situations. If you don't optimize your recovery, you might feel fatigued or too unstable to effectively engage with the next exposure, and the process of recovery will take a little longer. Exercise benefits your recovery, your endurance, your mental state, and it can't be avoided if you want to live a long, healthy life. I really hope you found this useful. Don't forget to hit subscribe. I'm Luke Vu. Be kind, be you. Catch you next time.